We are expecting to see a case at some point.
Nicholas Rupp, spokesman for the Salt Lake County Department of Health, on the likelihood of Utah soon seeing its first new case of measles. On Wednesday, the State Department of Health warned of another potential exposure in southwest Utah. They said an unvaccinated person with measles visited the area on May 26th and 27th. They said the person was out in the community and also visited with other unvaccinated people. Since there are several counties and cities across southwest Utah, I asked Utah DHHS if they'd clarify where people might be at risk. They would not do that. I also spoke with the Southwest Utah Public Health Chapter, and they said all they knew was what the state issued, although they reemphasized vaccination. And the Salt Lake County Health Department says just one of the 2 recommended MMR shots puts you at a rate of 93% effectively protected.
So that's a fantastic number. And if you get the second dose, you're up to 97.
33 states have reported having at least one case of measles, 1,088 total cases right now. 3 people have died from the virus.
So if you're going to be traveling, there's a good chance you'll be in an area that is seeing some measles transmission.
The CDC issued a recent warning to make alternative plans if not fully vaccinated and traveling this summer. It was Tuesday when Fox 13 learned of an infected traveler coming through the Salt Lake International Airport over the Memorial Day holiday weekend.
In this case, it was someone who really had very limited symptoms while on the flight, and overall had a very limited disease course overall. This person did recover very rapidly, likely because they were previously vaccinated.
Leisha Nolan is the state epidemiologist and says public health partners were notified, but not an all-out notice since they believe this was low risk. She says they'll keep emphasizing vaccination.
We know this vaccine, the MMR vaccine, is really effective. Nothing is 100%. I don't think we can ever expect anything to be 100%. So we will get a few people who will get the infection even after they've gotten the vaccine. But those people will have milder infections. They won't pass it on to other people nearly as likely.
Amy Nay, Fox 13 News, Utah.